Okay.
Good morning, doctor. My name is Jenny, Care Pharma. I'm here to introduce to you our first and only FDA-registered IV colistin with 2 million IU. When you need to break the toughest resistant, our Colisan 2 is the medication you need. Each vial contains 10 ml of cholestyramine sodium, a creamy white lyophilized powder for injection that is equivalent to 2 million IU. Colisan is a cyclic polypeptide antibiotic that derives from Bacillus polymyxavarcolismus and belongs to polymyxin group. Specifically, polymyxin E. After infusion of cholestyramine sodium, the inactive prodrug is converted to the active colistin. Polymyxins are cationic surface active agents that works by damaging the cell membrane. Once damaged, the resulting physiological effects are lethal to the bacterium. Before, colistin was largely replaced by aminoglycosides in 1970s because of its concerns of nephrotoxicity and neurotoxicity. However, aminoglycosides, on the other hand, also induce nephrotoxicity and manifest a clinical non-algeric renal failure with a slow rise in serum creatinine and a hypoosmolar urinary output which developed after several days of treatment. Thus, Colisan 2 was then reintroduced into clinical practice in treating carbapenem resistant. Based from Sergio Elizabeth Delswig, Stephen B. et al., multi-drug resistant antibiotic are types of gram-negative infections that have a resistance to other antibiotics. Not just this can cause is significant and this can cause a rapidly emerging threat to hospitalized patients as well as patients in the intensive care systems. Not just this bacteria pose a threat to hospitalized patients, but also creates a significant burden to healthcare systems. High-dose inhaled Colisan 2 is more safe and effective in treating ventilator-associated pneumonia caused by gram-negative MDROs. Colistin is concentration-dependent antibiotic. Unlike IV delivery, nebulized aerolized colistin is able to achieve higher lung concentration vis-a-vis serum concentration with a reduced risk of nephrotoxicity. For dosage and administration, there's an approved dosing guidelines by the US FDA and the European Medicine Agency, which varies from various degrees of the patient's renal function. This emphasizes the role of the loading dose. For depending if the creatinine clearance is greater than or equal to 50 ml per minute. If the creatinine clearance is 50 to 30 ml per minute, the maintenance dose is 5,500,000 to 7,500,000 IU. If it's below 30 to 10 ml per minute, its maintenance dose is 4,500,000 to 5,500,000 IU. If it's under 10 ml per minute, its maintenance dose is 3,500,000 IU for every 12 hours in equally divided dose as a 30-minute infusion. For the systematic treatment for children, its maintenance dose is 75,000 to 150,000 IU in every 8 hours in equally divided dose as a 30-minute infusion as well. For pregnancy women, there is no adequate data, including for breastfeeding women. It may be a risk for fatal toxicity. Colisan is FDA and PNDF registered. It also passed the bioassay and carefully evaluated by CEDRES. Its manufacturer is SRS Pharmaceuticals, a GMP-certified IV colistin, IV drug manufacturer. Colisan has an SRP price of 2,100 and is available nationwide in major hospitals and including Mercury drug stores near you. Once again, I am Jennine of Philcare Pharma. Thank you for listening and have a great day.
Patay, Jennine.
Wala na
Patay,
ako.
patay.